Yeah. Shall I unmute? Okay. Yeah. Yeah. Just put the phone on. This is down.
Good evening and namaste from India. My name is Pankaj Savardekar and I head business development and operations at medicaltours.care. In our business of medical tourism, we generally get to deal with medical professionals as well as patients and their relatives. And we come across some really interesting questions and instances at times, such as a few questions that we always hear is like, I never touched alcohol in my whole life. How can I have a liver disease? Or liver diseases are incurable, or only elderly have this disease. Then, with regards to the donations and liver donors, even they have questions like the donor's life is at risk, or donors must take medications for the rest of their life following donation, or after donation of a liver, female donors are unable to bear children, so on and so forth. So when we connected with Dr. Siddhachari at Kim's Hospital to share these questions, the first thing I heard on the phone was laughter. Followed by it, he said that it's not uncommon to have such questions. Almost all patients or their relatives come up with such questions as the knowledge is very limited or awareness hasn't reached the depth of the society. And that is where the idea of conducting this webinar was born. In this webinar, he is going to talk about the general liver health diseases as well as its cure, and lastly, the factual information about liver transplants. So introducing the doctor in brief, Dr. Siddhachari comes with 15 years of experience in gastro and hepatology, and he is a doctor in medicine from Minsk, Belarus. He has completed his master's in surgery from Tata Memorial Hospital, one of the most renowned hospital from India. Then he has done DNB in general surgery from India. He has also done MCH and MRCSED from Edinburgh, UK. FRCS he has completed in hepatology from Intercollegiate Board, UK, and European Board Certified Surgical Oncologist. And he also holds a diploma in laparoscopic surgery and diploma in neuroendocrine diseases from Sweden. This is the doctor at his job in the operation theater. And currently he is a head of the liver transplant team at Kim's Hospital. You see a very beautiful building of Kim's Hospital here. And it's one of the biggest hospitals in India, having 1,000 beds and a lot of other facilities like ICUs and pro surgery infrastructure in the hospital. The benefits of the doing that liver transplant at Kim's Hospital are it has a combination of internationally trained doctors. They have multidisciplinary team approach to patient care and state-of-the-art infrastructure, and they do various types of transplants over here. So, not taking much time, I request Dr. Siddhachari to take this presentation forward, and let's take the benefit of from this presentation. Thank you, Doctor. You can take it on from here. Thank you.
Yeah.
Please
Thank
share
you.
your screen. Please share your screen, Doctor.
Sure. Yeah. I will. Okay.
Not able to see the screen yet, Doctor.
Something happened. 1 second.
Sure.
Yeah. Able to see now? Yeah.
No.
Can you see?
No,
Yeah.
not yet. No, not yet. We can just see you, not the screen.
Okay. 1 second. Oh, right. 1 second. 1 second. Yeah. And No, this yeah, this one only. Yeah, this one. Yeah.
Oh, yes. Please put it on a
Huh?
presentation mode so
Yeah.
that we can see it in a bigger screen. Yes.
Yeah. Okay.
Absolutely fine. Fantastic.
Yeah.
I'm muting myself. You can take it on from here. Thank you.
Okay. Thank you. Thank you, Mr. Pankaj, for kind introduction. Uh, I think the time here is evening, so but I don't know what is the time there, maybe afternoon or morning. So good morning or good afternoon to everyone. Thank you for being here. So I am Dr. Ravichand Siddhachari. I am the head of the Department of Liver Transplantation and Hepatobiliary Surgery, KIMS Hospitals, Hyderabad. So as you can see, our hospital is, as Mr. Pankaj said, it's a 1,000-bedded hospital. So first, what I'm going to do now is I'm going to talk because I see that there are mixed audience there. Some of you are doctors, some of you are patients, and some of you are maybe relatives or other guys. So I'll talk about liver health. What are the precautions we need to take to maintain a good health, especially to look after the liver, and we'll talk to you about the liver diseases and how we deal with them. What are the treatment options available for liver diseases? So first of all, you need to know your liver. So you have to love your liver, you have to love your organs to maintain them so that they work well for you. Okay, so for that you need to know the liver. So your liver is the largest internal organ in the body. In the body, the skin is supposed to be the largest organ, but the liver is the largest solid internal organ, which is situated in the right upper part of the body, abdomen, and it weighs about 1 to 1.5 kilograms, and it does a lot of jobs. It does hundreds of work. So it is called as the factory of the body because it does so many jobs. So if you look at this liver here, it's a normal liver. You can see that its edges are sharp and the surface is shiny. This is the gallbladder which stores the bile. And look at this liver. It is so, the surface is so knobbly and it's very rough. And this is the diseased liver, or what we call it as cirrhosis of the liver. So what are the important functions which the liver does? So, liver is the organ which makes you feel good. It's a, if your liver is good, you will be very tired, weak, and you can't function anything. That is a, if you're feeling that, you're not feeling good, that means, yeah, there's something wrong with your liver. So it helps you, the digest the food. It produces bile. Bile is the one which digests the fat. It gives you energy. It stores the whatever the carbohydrates, the glucose you eat and drink, they are stored in the liver. And one of the most important thing it does is it cleans the blood. So it's like a filter. What if something getting mixed up with the blood, like infection or the medicines or any other thing, the blood is no, liver is like a filter. It cleans the blood, and also it produces proteins. The proteins are essential for building of the body and building of the muscles. So just a pictorial. So it stores a lot of things. Iron, vitamins, and minerals are stored in the liver. It produces bile, which is an essential for the digestion. It detoxifies all the chemicals. As I said, it cleans the blood, and it stores energy. The carbohydrate and fat are stored in the liver. And in the early years of life, it also produces blood. But it's very, in the kids actually. And it produces proteins and the clotting factors. Clotting factors means these are the things which are needed for the blood to clot. So whatever you eat, drink, whatever the food it goes to into the body, it has to go through the liver, and liver filters everything. So when the liver, is affected with some disease or some, so what are the symptoms you feel? You feel tired. That is one of the important symptoms. And you don't feel like eating. You feel nauseated. And there won't be any appetite. And you can have some swelling of the tummy, and it causes jaundice and itching of the skin. These are the main symptoms of the liver. Of course, there are lots of other symptoms but these are the main important symptoms. You can see the color of the eye here is yellow. So the liver, what it doesn't like, means if what is not good for the liver. Of course, everyone enjoys the alcohol, but for liver it is not good. When taken in occasionally, or in small quantity, it is okay, but if you take it regularly, daily basis, and heavy quantities, it's going to harm the liver. The second thing is there are, viruses. There are a lot of viruses which can affect the liver, like hepatitis. We have some A, B, C. It's named A, B, C, D, E hepatitis viruses. Okay, the bacteria can also infect the liver, but these are the viruses which are mostly, infecting the liver. And the fatty food, if you take too lot of junk food, like fatty food, junk food, fried items, the what we call as KFC, or all these McDonald's, no. So the fat can get accumulated. More and more fat can accumulate in the liver, and it starts harming the liver. And some of the medicines and drugs which may, damage the liver. So you have to always consult a doctor before taking any medicine, whether it is okay to take, how much to take, how long to take. So coming to the alcohol, so each person is different, so yeah, somebody may tolerate a bit more alcohol, somebody may tolerate, even 20 mils of alcohol is, enough to damage the liver. But it is impossible to say that, for you this much is sufficient and for you this much is sufficient. It is best to avoid the alcohol. In case if you want to take it occasionally, and always take with some healthy food. Don't take it in an empty stomach. Okay. So, and second thing is that, there are papers about how much to take in the Western literature, but it may not be suitable for everyone in the world. For, African population, it may be different. For Indian population, it may be different. For Japanese, it may be different. Chinese, it may be different. So you have to have your own country's guidelines, what is the safe limit. Okay. And coming to the viruses, as I said, there are at least 5-6 viruses which can affect the liver. These are named as hepatitis A, B, C, D, and E. So some of the viruses are transmitted through your mouth when you take the food or water or whatever. When it gets contaminated, means the food contaminated with hepatitis A or E, it can get into your body, and that can cause damage to the liver. It is very, very common in India, and also in I think it's also common in the Africa and Middle East and these countries. So it is less common in America and UK and Europe, more common in our countries. So hepatitis A and E, most of us get affected during our childhood, and they are self-limiting. You can get a spontaneous cure. There is no need to worry much about it, but sometimes, very rarely, in less than, if you say 1 in 1,000 people may have a severe damage of the liver, and they may need a liver transplant. So how to prevent infection of hepatitis A and E is, before eating food or drinking water, you have to wash your hands thoroughly, and wash whatever the vegetables, fruits, everything you are eating, you have to wash it well in the running water. It's very important. You wash it well in the running water, and also you can, these vegetables, fruits, you can dip it in a salt water. Then it cleans it well. And there is vaccination for hepatitis A. You can, it's available in most countries. You can take it. It is safe. That will prevent hepatitis A. However, we don't have vaccine for hepatitis E yet. Now, coming to hepatitis B, it is also quite common, and world over it is seen. These is a very dangerous virus. It can stay in the body forever if it gets infected, and mostly it is transmitted through blood. That means either when you take a blood transfusion, or you get an injection, contaminated needle can cause hepatitis B, or sometimes a mother has hepatitis B or father has, then it can get transmitted from mother to child. So sometimes the hepatitis B doesn't cause any symptoms at all. It may stay in the body and slowly damage your liver. And sometimes you see that, at a age of 40 or 50, that they come with a liver cirrhosis. Cirrhosis, I told you, it's a damaged liver, and they get jaundice, and they all throughout their life, they don't know, suddenly, and they're ill. So this is what is about hepatitis B. Now, hepatitis C is also like hepatitis B. It is transmitted through blood or contaminated needles. And again, the same as hepatitis B, no symptoms. Patient may be well, suddenly can develop jaundice and swelling of the tummy or the body and like that. So now coming to the prevention and treatment. So how do we avoid, what do we do to prevent the diseases of the liver? So as I said, hepatitis B and C are transmitted through blood and needle pricks, and it can also get transmitted, in a barber shop, for example, somebody is using the same razor, and the barber is not changed the blade and he's put the, blade onto you. That used to happen in the 1960s, 70s, when they didn't have disposables. Now it's very uncommon. But be careful with the tattoos. The tattoos the people get, they use the same needle to, prick it and put the tattoos. So you have to be very careful. And there is vaccine available for hepatitis B, and it is very important that all the kids, all the newborn child, they get vaccinated, and all those who have not taken the vaccine yet, they have to take the vaccine. This is going to completely, avoid this disease. It's a very simple vaccine, and it's very essential. So now, what about, alcohol and the fatty food? So the fatty food is about, as said, it's a junk food. It's from McDonald's or KFC or something like that, where it's fried, deeply fried, and lot of fat in it, and less vegetables. This is going to harm the liver. So fatty liver is now becoming very, very common because of the urbanization, because people love to eat all these junk foods. Yeah. And the also the lifestyle has been changing, because now people love to relax and sit in front of the TV and eat plenty of food watching the TV, and also at the same time consume some beer or wine or liquor, something like that. So that causes liver damage. No. So although, this food may not be tasty, but it's very healthy. You see, consumption of the vegetables and the fruits, the liver loves these vegetables and the fruits. So, and also the dry nuts, these are the healthy foods. So always include vegetables, fruits, nuts in your food. So these are the things which is good for the liver. So healthy food, healthy body weight, and your liver is fine. You don't have any liver problems. Okay. So, and other thing is you need to do regular activities, exercise, daily exercise. You need some amount of exercise, even if it is 20 minutes, 30 minutes, you have to do the exercise that is good for your whole body and also for the liver. So what is unhealthy liver? This is what is unhealthy liver. This is a very, completely damaged liver which is being taken out and a new liver has been transplanted. See, as I said, this guy is sitting in front of the TV with a remote and eating a lot of chips and drinking beer. What will happen to his liver? Of course, he is going to get, bad liver. So there are how to detect the if for example by chance you got some disease, then how to find the disease. Now basic tests are the blood test, the ultrasound of the liver. So the blood test will do the liver functions and that will tell you about whether your liver functions are good or not. If the blood test shows some problem, then you do the ultrasound of the liver. The ultrasound shows whether your liver is normal, whether the size is normal, or whether the surface is okay or not, and it picks up any tumor, stones, or anything like that. So in case if the ultrasound is not conclusive, then you go for higher investigations such as CT scan, MR scan, and PET scan. If you have a cancer or the cyst or the stones, you can do the either MR scan, CT scan, or PET scan after consultation with your doctor, of course. So some of the disease need surgery and some need medical treatment. I won't go into the details, but so there are plenty of diseases which can affect the liver. So these are the most common diseases, and some of them are acute in the sense they come, damage the liver, and some of the diseases are chronic in the sense it's a slow process. It's like alcohol, the person may be drinking alcohol from the age 20 or so up to 30, so the liver is slowly getting damaged. Similarly, hepatitis B and C cause slow damage of the liver. Fatty liver, again, it is a slow disease. Autoimmune Wilson, these are very slow diseases. They slowly damage the liver, and by the age of 40, 50, then your liver is completely gone and you present with swelling and jaundice. And these are the diseases which affect the liver, like it's like a fever which comes and goes. The mostly you have spontaneous resolution of the disease, but sometimes you may end up with a liver transplantation when the liver is completely damaged. So regarding precautions and prevention, just to wind up. So eat healthy food, a balanced diet, less carbohydrates, less fatty but high protein diet. Exercise regularly. Avoid, or I mean, if at all required in the social meetings and all, you consume very little alcohol. Get vaccinations. There is vaccinations available for hepatitis B and A, and always consult a doctor before taking a medicine, because some medicines may not be suitable for the liver. So as I said, other things are like avoid contact with contaminated blood and needles. Okay. And tattooing, you have to be very careful, whether they are changing the needle when they are doing the tattooing. That's very important. And of course, don't use other person's personal things, and don't take any junk foods, and all these some of the contaminants, and follow the medications. So this is about the care of liver. Now I will come to the next step about what the doctors do when somebody is badly affected with a liver problem. So I'm going to put a new presentation here. So ಇದು ಕಾಣ್ತಲ್ವಾ? Yeah, sorry. Can you see the slides? Can you see the slides? Hello?
We cannot see the new slides, doctor. We can see
Oh,
the old
okay.
one. Yes, yes.
Oh, right, right. Oh, sorry, 1 second. I'll just close the old one and
Yes,
maybe,
yes, please. Yes.
yeah. Wait.
Audience, thanks a lot for
Yeah,
your
can you
patience
see
and
now?
hope you are enjoying the presentation.
Can you
Yes,
see
yes,
this
doctor.
news?
Yes, doctor.
Yeah.
We can see this.
Yeah, just a bit about liver transplantation. Liver transplantation started in 1960s, as early as 1960s, and however, only up till 1990, it was a very slow and steady this thing. But from 1990 onwards, we started doing a lot of liver transplantation. So coming to the indications, as I said, when liver gets completely damaged, that is called cirrhosis of the liver, and when the liver cannot function anymore, then you need liver transplantation. So these are the indications, alcohol damage of the liver, hepatitis B, C damaging the liver, as I said, fatty liver also can become cirrhotic. You have a liver cancer called hepatocellular carcinoma, and that also needs liver transplantation. Some people have autoimmune liver disease, just like a rheumatoid arthritis or psoriasis or something like that. So liver also can get affected by autoimmune disease. Then you have a copper metabolism problem called Wilson's disease, that also needs liver transplantation. And as I said, sometimes you can have suddenly, somebody is very well, but tomorrow he takes some contaminated food or something, and in 3 days he gets affected with bad virus, and that damages the liver badly, and that's called hepatitis A and E, and they cause acute liver failure. And some of the herbal medications, sometimes in India we use some herbal medicines, they also can damage the liver. And TB is also quite common in our country, and some of these TB medicines can damage the liver. So always consult a doctor before taking these medicines. So now coming to, as I said, this is all about the adult transplants now. In children also the liver gets affected, and most commonly these are the congenital malformation, biliary atresia, where the bile duct is not formed properly and the bile is not coming down into the intestine. That is the most common cause of the liver problem in kids. And you also have other diseases, metabolic disorders, autoimmune and other diseases. Then the kids need liver transplantation. So as I said, when you have liver problems, you have some symptoms. I told you about the fatigue, the nausea, loss of appetite, and all this. When you have an advanced disease, when the liver is very badly damaged, then you get jaundice, you get ascites, in the sense you build up the water is in your tummy, gets stored, and your legs start swelling up, and the water can also go into the lungs. Uh, as I said, liver, it gives you healthy feeling. When the liver is damaged, you are very feeling tired, weak, and you feel sleepy during the day. You are not active. That's called encephalopathy. Then it controls the clotting, and when the liver is damaged, the blood is diverted away. So these blood can rupture and cause bleeding. And of course, the liver cancer called hepatocellular carcinoma, this needs a liver transplantation. And so you can see the pictures here. This guy, he has got a very yellow eye, it's a jaundice, and this is the water in the tummy. You can see that this guy is all skin and bones, and he's got at least 20 liters of water in this in his stomach. And this is a very peculiar disease where the liver blood vessels are completely blocked and all the blood vessels are running through the skin. It's called the Budd-Chiari syndrome. And you have a lady here with a huge ascites, and the water is actually pushing and causing the hernia here. So this is one of the very bad disease. So why actually we advise transplantation? Why can't we, just control with the medicine? Because medicine you can pull out, some up to some days and years, but when the liver is completely destroyed, you need transplantation. Otherwise, if you have develop a bleeding, the life decreases. If you develop ascites or the infection, then the life decreases so much that you can't live further. So there is some scoring system in our liver transplantation, and this is about the scoring. So if you have a score of there are two types of different scores. The CTP score more than 9, this can be calculated very easily in your phone. If this is the score, then you need liver transplantation. If you have a liver cancer, then you need liver transplantation. If you have an acute liver failure, as I said, some infection causing the liver damage, you need liver transplantation. Now, you don't need this. You can see this white stuff here. This is a cancer. This is the, this is a damaged liver. This is a cirrhotic liver, and you have a cancer here. So this liver has been taken out, and we have put in a new liver, and this guy is doing well now. Now, some of the other symptoms of the liver damage are like failure to thrive. They may children may not develop at all. They don't build up the muscle and this thing. Their development is very slow, and some may get very bad itching. Pruritus is itching of the body, and this is not required. So some page, this is also not required. Now coming to the scoring, this is what the scoring we use. This is the different symptoms put together. You calculate the scores, and this is called the child book score. And we have three categories here: A, B, C. So person with A, you can continue with medicines. Person with B and C, you definitely think about transplantation. Now this is a score which is very important, and all over the world we use this score, and this can be calculated in your mobile phone also. It's available in the web, and putting few important liver functions into that, it gives you the score. Anybody with a more than 15 needs a liver transplantation. Now, coming to the transplants, there are two types of transplants. One is a deceased donor, deceased in the sense somebody with a brain death. Brain death in the sense somebody who had an accident where the brain is damaged, or somebody who had a bleed into the brain, or ischemic strokes. Their brain is dead, and the person is not going, he won't live any further. Then that's called the deceased donor liver transplant or cadaveric liver transplantation. Then you have living donor liver transplantation. This means that your own close relative giving part of the liver, liver, like kidneys, there are two kidneys, one kidney can be given, but liver, although it is one, we have the we have developed the technology, we have developed the skills to divide the liver into two and give it to the deceased person. So as I said, in India, we do most of the liver transplants are living donor types, means a relative donating the part of the liver, and very small percentage is cadaveric liver transplantation. Now, as I said, these are the causes of brain death. The trauma most commonly, then you can have a bleeding or ischemic stroke. Person who is brain dead, this is the way we procure the organs. This is the liver here, these are the intestine, and this is the heart, lungs. So you can use almost 8 to 10 organs from this body. You can use the heart, the lungs, the liver, pancreas, intestine, kidneys, so on and so forth. So this is the way we harvest these organs. You connect blood vessels. We have certain fluid which flushes the blood out of the organs, and it cleans the liver, and they are preservative of the organs, and you store it in a cold box, and then when you have the patient ready, you put it into the. So this is the ice slush. You can see we have put the ice slush here, This is the fluid, and we flush out the blood. If you see this one, this is the whole liver taken out from a dead person, and this is the fluid. This is a preservative fluid. This is how we store it. This is the ice surrounding. So you cool it and then store it. And this is the whole liver. You can see it. Yeah. And sometimes we can also split the liver into two. A bigger portion you can use it for an adult person, and the small portion you can use it for the kid. This is a bad liver. This is a cirrhotic liver, and we are in the process of taking it out. And this is a blood vessel, the cava, the right hepatic vein. So, and the liver is coming out, and then we have to start putting in. So the liver is out from the body here. This is the big vessel, the hepatic veins connecting. The blood goes from here and to the heart here, and so we start joining. So all the blood vessels are joined, here the portal vein is joined, the artery is joined, and then the bile duct is joined. This is how we complete the operation. So there are some 5 6 different joinings. The cava is joined here, and then the portal vein, then the artery. This is the hepatic artery, and then you have the bile duct, and the operation is completed, and this is how the new liver looks, and this is a completed one, and he is going to go with the new liver. Now coming to the living donor, I told you this is about all the cadaveric transplantation. Now the living donor. So liver has a unique capacity to regenerate. That is the principle behind a living donor liver transplant. If you take out, up to 70% of the liver can be removed, and it can regenerate to its original size in about 6 to 8 weeks. So these are the different parts, what we call as segments of the liver. And when we are taking the liver, we have a calculation, and we do a thorough workup of the donor. Now coming to the donor, everyone asks, can this person donate this? So what is our parameters we use to select a donor? So a donor should be healthy. His age should be more than 18. This is the legal age to donate, and he should not be more than 50 or 55 at the max, because this is the time when your organs are in a good working condition. As you grow older, 60, 70, your organs may not be in a very good condition. The donor should not have any diabetes, BP, or any other serious disease. The blood group should match, in the sense it is same thing as like a blood transfusion. A donor can give it to anybody, and A to A, B to B, but AB can receive from anybody. AB is a universal recipient, and O is a universal donor. And the donor should not have any viral illness, so you do a thorough viral checkup. Should have a normal liver functions, hemoglobin should be normal, kidney function should be good, and should not have any fatty disease, thyroid disease. And then after that, you do a CT scan and find out so, whether his liver is suitable or not. Sorry. 1 second. 1 second. Sorry. Yeah. Okay. Sorry. So once you find that is suitable, then we need to do some paperwork, because the transplantation is a a huge process. You need to get an approval from the government committee. You should first prove that is a relative of the patient, should have certain documents and letter from the treating physician that this patient needs a liver transplantation, and also a letter from the country where he's coming from. The embassy of the country should provide a letter. Okay, and he also should be fit for the surgery. Any person with a above 18 up to 50 who is young and this thing, he should be able to donate. And we do, as I said, the CT scan to check the anatomy and the volume, how much liver he can donate, and then get the approval. So this is the anatomy of the liver. This is the hepatic veins, and these are the portal veins. There are different types. I won't go into the detail. And this is the hepatic artery. So the CT scan shows all these structures and check whether they're. And this is the cholangiogram. This is the bile duct, and you can see the bile duct is divided into right and left branches. And then you see how much each one. Every person will have different sizes of liver. Somebody may have 1 kilo liver. Somebody may have 1.5 kilo liver, and we're going to calculate the estimate the size and weight of the liver, and then decide how much liver to take. So this is arbitrary division of the liver. So the donor will have a cut in the body something like this, because liver is situated here in the right upper part of the stomach or the abdomen. This is the cut we give, and we split the liver. We split these are the blood vessels which are running into the liver. So there is a right and left division, and we split the liver and we take out the part of the liver. So this is again the splitting of the liver. You can see this is the whole liver and this is the liver which has been divided. Yeah, and these are the recent technology. Now we have a robot, and we also do laparoscopic surgeries. So these are the position for the robot laparoscopic liver resection. This is inside the body, and this lady, she had a robotic donor surgery. You can see that these are the small scars, and the liver was taken out down from here, the bikini area where she cannot see the scar. So this is the liver. The right part of the liver has been taken out. You can see that part, only left part is remaining there. Then you go for the patient operation. You've taken out the liver and then you have to put it in. So this is a small baby, as I said, with a biliary atresia. Biliary atresia is the most common disease of the baby. So she had some surgery in the past and that was not working. So we took her for a liver transplantation. So this is a boy who had a problem with the liver. You can see his tummy is bulged up, and yeah, this boy needed transplant. This is a 2-year-old baby with jaundice. No, this is before transplant, and this is the after transplant. You can see how different the baby looks after the transplant. This is a healthy look, and this is a you know poor this thing. This is again the same baby who had before transplant, and this is after transplant. You can see the color of the baby and the healthy look of the baby. This is another baby who had a transplant. This is after the transplant. So babies need small part of the liver. Usually take about just 20 to 30% of the liver. This is the liver which we have taken out, and this is the liver which is going into the body. This half of the liver we have taken out. You can see the hepatic veins here. You can see the portal vein here, the artery here, and the bile duct here. So and then this is how we put it. This is the IVC or the cava, and this is the right hepatic vein, and we join. And this is a transplanted liver. Oh, this is a transplanted liver. This is the veins which are joined, the portal vein, the artery, and the duct. This thing. Then you do a ultrasound to check all the blood vessels are working fine. The flow of the blood is good in the liver or not, and check. There are certain complications which I will not go into the detail, but these patients need medications for to maintain that liver, and we give a lot of medicines in the beginning, but slowly we decrease over a period of time, and after 2 years he'll be only on 1 or 2 tablets a day. So the success rate of liver transplant is more than 90%, and 5 to 10%, because it's a big operation, you can have complications, and some 5 to 10% of the patients may not make it. after the transplant, it's very important that the patient feels very well. He'll be relieved of those symptoms he had, the jaundice, the swelling of the body, the ascites, and the pain he goes through. And he'll be emotionally also he will benefit. And there'll be improved functional capacity. He'll be able to walk normally. He'll be able to feel normal. There'll be he doesn't need any help for himself, to take care of himself. He'll be able to do all the activities which were there before the before he had. And he'll be able to work also. So a lot of our patients are now working. They're able to join back their work. They can do the office work, they can do the field work, but they can't just do the sport work, because the swimming and the running and all those things should be avoided. They can enjoy the normal life after the liver transplantation. So very few patients can develop some problems after the transplant, which can be again dealt with. You can again treat them and make them fit again. So these are some girl who had a transplant and she is now going to the school. This is a boy who had a transplant. Now his father was in army. Now he loved to wear the army dress and he is doing well now. Now this is a lady who had a acute viral illness and she had a acute disease, acute liver failure, and now she is doing very well. This is another lady who had transplant. These are the ladies who had transplant, and they're all doing well and good. So thank you for listening to me. It was a long talk. I hope it was okay. You could all understand. I'm happy to take any questions you have. Please speak up.
Thank you, Doctor, for a very detailed and lovely presentation.
Thank you. Yeah.
Yeah, so I have received some questions.
Yeah. Yeah.
Uh, okay, so question one is from Jekapu Simvingaf, who is from
Uh-huh.
Tanzania.
Uh-huh.
And he's asking, how is the life expectancy for the patient of liver transplant?
So, as I said, the life expectancy is 90% of the patients they do well. From 5 to 10% may develop complications. So, at 1 year, if you take, what we just roughly calculate like this. So, if 100 patients undergo transplant, 90 patients will be alive at the end of 1 year.
Mhm.
Okay. And at the end of 5 to 10 years, there will be at least 75 to 80% will be alive. Now, some patient may develop complications which may or may not be related to liver alone. They may develop, some heart problems, the lung issues, some infection, something or the other. So whatever the liver problems, if they develop any rejection, infection, and all these things, it can be treated again. So the success rate is about 90%.
Okay, thank you. The same person has asked for one question. How can patient with hepatocellular carcinoma benefit from liver transplant?
Yeah. See, a patient with a hepatocellular carcinoma, if the liver is normal, which means if it is not cirrhotic, we can just take out the tumor and he'll be fine. But most of the patients they come with a diseased liver in the background of a cirrhotic liver, means the liver as such is a bad liver. On top of that, he has got a hepatocellular carcinoma. In these patients, they need liver transplantation, which is which will cure both the liver disease and the cancer also. And these patients, if they are they come early in the life, then we can cure them. If they come with a disease which has gone to other parts of the body, like the cancer has already spread to lungs or bones or other parts, then we can't do transplantation. If it is limited to liver, and if the size is less than 6.5 centimeters, we can almost give a cure to these patients.
Okay, then we have received one question, very interesting one from Tulari Tine. The question is, first of all, a compliment. This is a great presentation, doctor. Just wanted to know if it's true or myth that hepatitis B and C can be transmitted through sweat, pasina,
No,
sweat.
no. I mean,
okay.
theoretically, these viruses can spread through any body fluid. Okay. Blood is the most common because it's there in the blood. Now, other body fluids, theoretically, it can, but practically, we have not seen, that because, sweat or the, saliva, the quantity is very small and the virus presence is very, very little. However, it can present sometimes through sexual activities. It can, pass it through sexual activities.
Okay. Thank you. Next question is from Olivasen Adu. Question one is, what is the minimum cost for liver transplanting?
So the cost.
Yes.
The cost, can I say in dollars? Because I think your currencies maybe.
Yes.
You see, the cost depends. If the patient is in a serious condition, then it may be a little bit more, and patient in a good stable condition. Some patients, they come in a very, very end stage where even the kidneys have damaged and there are infections, then the cost goes up. This is roughly, I would say, it will cost somewhere between 30,000 US dollars to 50,000 US dollars.
Depending upon the complication.
Yeah, if a straightforward transplant may cost about 30,000, 35,000 US dollars. If they develop any complications, and then it may go up to 50,000 US dollars.
Okay. Oluwasen Adu has asked another question. How fast it is to get a donor? Now this is basically a question whether we get donors over here or they have to get their own donors from their own country.
Yeah, no, they have to get their own donors because we can't allocate any donors from our country here. Even our own patients here, they get their own donors, because the law is that the donor should be relative of the patient. It cannot be some other person. It has to be relative of the patient as per the law. So they have to get their own donors.
So I just wanted to add on to it, like, why is it restricted in India to have a family donor? Is it to stop or cut some kind of?
No, it's not just India. Throughout the world, you go anywhere in the world, it is restricted to only the relatives, because to stop the illegal activities, to buy a person, some rich person may just buy, some poor person may want some money, and for that he may donate his kidney or liver. To stop this illegal activity, it should be a relative. A relative, although I mean, relative may also need money, but more usually if it is father or son or mother, close relatives, they won't, take the money. They will donate. But if it is somebody, some friend or somebody who is in need of money, they can sell their organs. To stop these illegal activities, every country has a law. Even if you go to US, UK, or any country in that sense, it has to be a relative only. It can be cousins, it can be uncles, aunts, it can be brother, sister, mother, father, like that. But it can't be too far relations where you can't prove the relationship. You have to provide a document mentioning about your relationship.
Okay, okay, understood. Okay. We have very few time left,
Yeah.
little light time left for the seminar. Just some quick questions. Uh, we receive a lot of cases stating that they are suffering from hepatitis B,
Uh-huh.
and then there are stages of it. And then what is the treatment for it?
So hepatitis B, if it is detected early, it has a very good treatment. We have very good medicines for that, for the cure of the disease. But hepatitis B, if it is detected late, when the liver is already damaged, when the symptoms of liver failure starts appearing, then such as jaundice or ascites or encephalopathy or the then he will need transplantation.
Okay, okay.
Yeah.
One question from Barambas Saidu.
Mm-hmm.
Uh, is I have, sorry, Mebwaza Gloria. I have been treated
Mm-hmm.
from mass ascites and
Mm-hmm.
now having progressive hernia. How can I be helped?
So that means he needs a liver transplantation.
Okay,
Because see, you can use the diuretics, the tablets, water tablets. So if you give these tablets, you can get rid of some of the water. The kidney starts functioning more and tries to get the water out. But if even after taking these medications, if the ascites doesn't respond, then he needs transplantation.
understood. Okay.
Yeah.
Austin Oseji. Now, Mr. Austin Oseji is actually in need of a liver transplant, and his question is, what happens in the case of a patient with PSC during transplant? Does it mean the bile duct of the donor will be used to replace the diseased one in the patient?
Yes. So a PSC patient will have a donor who is healthy. So the whole liver will be taken out, all the ducts will be removed, and the donor ducts will be used. So I mean, although there are chances, PSC is an autoimmune disease, and we post transplant he has to be on medications. So 70 to 80% may not get the disease again, but there is 20% of the patients may get the PSC recurrence. It is not
Okay,
because the donor had the problem in the duct, it is because his body reacts like that.
okay, okay. And the last question
Yeah.
is there any fear or risk factor for the donor? Life expectancy, quality of life, which is
Okay.
usually affected? Yes.
The donor usually stays in the hospital for 1 week until the wound problem is sorted on until it recovers. After that, we discharge them, maybe 1 week, 10 days. Then he doesn't need any medications during his lifetime because his liver would have grown and he will be functioning normally. He doesn't need to take any medicines. He will be normal. First 3 months we ask them to avoid heavy sport activities. That means jogging, running, swimming, and any of the heavy activities. After 3 months, once the wound is completely healed, he can do all the normal activities.
Okay. And what about recipients or donors, females especially, can they bear babies later?
Yes, of course. Yeah, yeah. So donor also will not have any problem, and the recipients also can bear babies. No, no issues.
Okay. So due to the restriction of the time, I think we will end the presentation here. But I'm going to share this thing on YouTube very soon, and I will share the link with all the audience. Okay. Thank you, doctor, for a detailed presentation. It was a very, very uh, great time spent with you and could get a lot of insights. Yeah.
Thank,
And
thank
yes, sorry, doctor. Yes.
Yeah, thank you, Mr. Pankaj, for organizing this. So I hope everyone had enjoyed the talk. So thank you to yourself, for organizing this talk.
Okay. Thanks a lot, doctor. Thank you. Thank you.
Okay. Yeah. Thank you.
Okay. All
Yeah.
right. Bye-bye.
Okay. Bye. Bye.
And
Bye.
audience friends, yes, I'm going to share this link of the YouTube video soon. I will WhatsApp it to you.
Yeah.
And
Yeah.
whatever other questions that we have received, I'm going to email it to doctor, and we'll send you the answers personally on your WhatsApp numbers. Thank
Sure,
you.
sure, sure. They can always they welcome. Anybody can email or WhatsApp. I'll be able to answer their
I
questions.
will
No.
do it on their behalf, doctor.
Oh,
Thank you.
perfect, perfect. That's great. That's great.
Thank
Yeah.
you. So we are ending the session over here. Thank you. Thank you.
Thank you, Mr. Thank you, thank you.
Yes.